Hi, this is Dr. Sushanth. I'm an orthopedic surgeon with special interest in joint replacement surgery, arthroscopy, and joint preservation procedures. Today, we're going to be talking about knee arthritis. Our knee joint is one of the most important joints in our body. That's what we walk on. This is a knee joint. It is basically involving three bones. That's the lower end of your thigh bone, femur, the upper end of one of the upper bones of the upper end of the leg, that is the tibia, and another sesamoid bone called patella. All these three together make a knee joint. Okay, all these joints are covered with a spongy layer of cartilage, 3 to 4 millimeters, which makes the movement smooth. And then it has structures like the meniscus, the blue colored thing, which acts like a shock absorber or a cushion. What is arthritis? Arthritis of the knee is basically when the cartilage covering the bones is eroded and causes pain and inflammation. Now we have stages of arthritis. We have stage 1, stage 2, stage 3 and stage 4. So stage 1 is an early arthritis wherein there is very little or minimal degradation of the cartilage. And as you progress to stage 2 and stage 3, there are secondary changes which occur in the cartilage and the structures within the knee joint, that is the meniscus and the ligaments. And by the time you come to the stage 4 arthritis, most of your cartilage is all worn out. You have just two bones grinding against each other and all your ligaments and your meniscus are worn out. Symptoms of arthritis. How do you find out that you have arthritis? Usually it starts with small pain in the knee, especially while walking uphill, downhill, while using the stairs, and so on. And how do you diagnose it? The best way of diagnosing arthritis is through a plain X-ray, a weight-bearing film of the knee joint, which will show us whether there's any arthritis. Now, how does and why does arthritis occur? Yes, majority of the arthritis can be a genetic predisposition, meaning if you have a family tendency of having arthritis, which runs in your family, there's a high 50% chance that you will get it as well. But yes, there are other things like overweight, old injuries to the knee joint, which could be an old untreated fracture, could be ligament injuries or meniscal injuries in your knee, which could all precipitate to a knee arthritis later down in your life. So as I told you about the 4 stages of arthritis, depending upon the stage of the arthritis, we have the treatment for it. Now, as I told you, X-rays could help us diagnose level and stage of arthritis. And then if you're in stage 1 and stage 2 of arthritis, very simple treatments are available, such as lifestyle changes, number 1. So if you're overweight, then probably weight reduction, and then other activities like probably you can avoid using stairs, squatting, sitting cross-legged, and then yes, exercising on a regular basis and knee strengthening exercises will also help you regain to normalcy. And yes, we give you anti-inflammatory medications, oral medications, and then we have supplementary medications which will help regenerate your cartilage as well as recoup your knee. Once you're coming to stage 2, stage 3 arthritis, and when you have secondary changes in the knee joint like meniscal tears, ligament tears, there you might need intervention, which is called as an arthroscopy, wherein we can repair the meniscal tears. We can take care of the small cartilage damages in the knee joint with a very minimal daycare surgery procedures. At the same stage, we can also give you viscous supplement injections, which are a daycare procedure. And then we also give you PRP, that is platelet-rich plasma injections on a daycare procedures. And once you are done with these procedures, then you can get back to physiotherapy and exercises which can recoup your knee. But if you end up in the 3rd or 4th stage of arthritis, that's the end stage of arthritis, and if the age is right, and then if it cannot be cured by all the treatment which I have mentioned till now, knee replacement surgery is where we go to remove all the worn out part of the knee and then replace it with this metal alloy and a special plastic called as polyethylene. And we change the whole joint, which is a permanent solution for the knee arthritis.